In your health headlines, February is American Heart Month, and recent studies show heart disease is being underdiagnosed and undertreated in women. Dr. Mitchell Goldman with UCSD is here now with why this may be the case and what women should be on the lookout for. Dr. G, welcome back.
It's good to be here.
Well, when it comes to women's health, we hear a lot more about breast cancer than we do the #1 killer of women, which is heart disease. How important is this Go Red for Women campaign we've been seeing all over town in February?
You know, amazingly important because only 20% of women know that heart disease is actually a bigger risk of death than breast cancer. And last year alone, over 50,000 American women died of heart disease.
And when you think of all the things that women are juggling, that makes perfect sense. And it's strange that we don't know, Dr. G. But one of the biggest issues when it comes to heart attacks in women has to be the fact that the symptoms are different in women than they are in men, correct?
They are. In men, it's more of like a crushing chest pain that they have with radiating down the arms. In women, it's very different. Sometimes they get a jaw pain. Sometimes it's just nausea. Sometimes it's back pain. And then other times it's just a sense of foreboding that something is really wrong. And what makes it worse is that, as we know, women have a lot to do. Women take care of the husbands, the family, work, everything. And so what women try to do is they just put it off. They just say that the symptoms are not that crushing chest pain, so they put it off. They don't go to the doctor. And that's why women have a higher fatality rate from heart disease than men do.
Certainly a scary notion. Are the risk factors for women the same as men, or are we as women more susceptible in any way?
Well, yes and no. You know, the major risk factors for both men and women are high blood pressure, high LDL levels, which are cholesterol levels, and then also smoking. So those are things that we need to check on. We need to always have our blood pressure checked, keep it under control, of course, stop smoking, and make sure you're eating properly and exercising, which basically lowers that high LDL cholesterol.
So I think we actually have a list for our viewers. So what are other ways that you can decrease your risk?
Well, of course, the most important thing is what we just said, stopping smoking and exercising. But you know, there's other things like making healthy food choices, limiting alcohol. Remember, we talk about a glass of wine or a beer a day. That's probably all you should be doing. And then the single most important thing is women have to realize that they can get heart attacks. They need to know the symptoms. But some of our populations actually have an even higher risk, especially Hispanic women and African American women. And the risks come because they are sometimes more obese and have diabetes. So obesity, diabetes, and high blood pressure are higher in our Hispanic and African American populations, and so that places them at even a higher risk with a higher death rate from heart disease.
All right, Dr. G, thank you so much for educating us women on exactly what we should be looking for. Thank you.
Because we need to keep you guys around to take care of us.
Absolutely. The dominoes fall that way, don't they? Thank you.
Thanks.